So today we're going to talk about hearing, balance, ear infections, but instead of talking about human hearing, we want to talk about hearing in cats and dogs because they're a lot cooler. In fact, humans can only hear from 64 to 23,000 hertz, while cats can hear from 45 to 64,000 hertz. Just like the human ear, dogs and cats' ears are separated into three main regions. The outer ear, starting with the pinna, is mainly responsible for funneling sound waves into the middle ear. The pitch of the sound depends on the frequency of those sound waves. Higher frequency waves are interpreted as higher pitch, and vice versa. The volume of a sound is also dependent on the amplitude of the waves. Higher amplitude, higher volume. The pinna, or the external portion of the ear, funnels these sounds into the ear canal. The ear canal of cats and dogs is more L-shaped than compared to the human ear. This L-shaped canal makes it easier for fluid to enter and become trapped in the ear canal, which can lead to infection. An infection caused by bacteria, yeast, ear mites, or another allergic reaction can lead to inflammation. Bacteria or the other infectious agents damage the infected tissue, which causes the release of a histamine, which is a chemiotic factor, which leads to increased capillary permeability and blood flow to that area, leading to inflammation. The inflammation of the external ear canal is known as otitis externa. Otitis can occur in each of the regions of the ear, depending on the depth of the infection.
The middle ear connects the tympanic membrane to the three ossicles. Once vibrations reach the tympanic membrane from the external ear, the vibrations are passed to the malleus, incus, and the stapes, which function to amplify the vibrations to pass through the cochlear fluids within the inner ear. This is an important concept because vibrations are much harder to transduce from air to liquids, which requires amplification of the vibrations. From the middle ear, the vibrations are then transduced to the inner ear to be interpreted. Otitis media, which is referred to as inflammation of the middle ear, usually results from extensions of infection from the external ear canal through the tympanic membrane, as well as migration of pharyngeal microorganisms through the auditory tube. One of the major complications of the middle ear is a tympanic bulla, which is the cavity past the tympanic membrane which can build up with fluid and become difficult to treat due to the L-shaped anatomy of the feline ear. The common cause of all forms of otitis media is dysfunction of the eustachian tube. This is usually due to inflammation of the mucous membranes in the nasopharynx. Because of the dysfunction of the eustachian tube, the gas volume in the middle ear is trapped, and parts of it are slowly absorbed by the surrounding tissues, leading to negative pressure in the middle ear. Eventually, the negative middle ear pressure can reach a point where fluid from the surrounding tissues is sucked into the middle ear cavity, or the tympanic cavity, which causes a middle ear effusion. All of these complications can lead to severe problems and ultimately may lead to otitis interna.
For the inner ear or labyrinth, within the cochlea, there's a basilar membrane and organ of Corti. This is the cochlea, and this is the semicircular canals. With hearing, it refers to the cochlea. So within the cochlea, in the organ of Corti, sounds cause hair cells to deflect and cause mechanically graded sodium channels to cause graded potentials, which may lead to action potentials. These go to the cerebral cortex in the brain. Pitch is determined by frequency of sound waves in the brain, and location of hair cells triggered in the organ of Corti. Louder sounds cause bigger graded potentials, which causes more frequent action potentials. As for balance and equilibrium, these are caused by the semicircular canals, which is what modifies this balance and equilibrium. Hair cells are deflected by the fluid's movement within the semicircular canals. This affects the equilibrium. The semicircular canals transduce angular acceleration. As the inner fluid moves, it accelerates in space, and this indicates how you are accelerating in space. Whether side to side or up and down, it keeps your balance. Otitis interna is the infection of the inner ear, which causes the animal to have a head tilt, or it causes them to start shaking their head. This is the inner ear, and this is within the inner ear, the otitis interna. The infection of otitis interna causes the animal to have a head tilt, where they favor the side of the head which ear is infected. So there's a left tilt if the left ear is infected. This is due to an imbalance of semicircular fluid equilibrium due to the inflammation by the infection. If both ears are infected, this causes dizziness. Sensory disconnect. When you spin, then stop suddenly. The semicircular canal fluid is still moving, but your eyes register you as standing still. This causes sensory disconnect and can cause dizziness.
So when treating any type of otitis, whether it be externa, media, or interna, you want to clean it at first with a product called Tris Ultraquita, which has an antifungal within it. It's a cleanser, and it also has an anti-drying agent, so that way moisture doesn't build up with any part of the ear. But with treating otitis externa specifically, you want to use products such as Cerulin or Positec, which have antifungals, anti-inflammatories, and antimicrobial agents within them to help treat the external environment, to reduce the swelling and to reduce all the extra bacteria within them. But when we get to otitis media and interna, it's different treatment, and these two are relatively the same, and you would want to use antibiotics such as ticarcillin or antifungals such as miconazole, and an anti-inflammatory such as dexamethasone. Oh, Jesus. Oh, fuck. Oh, my. Oh, shit. Okay. Oh, fuck. What? Oh, wow, the room's spinning.
Played it off.
And this is sensory disconnect.
No, it's not. Alright, so with otitis externa, you want to use something called When treating otitis externa, you want to use a cleaner at first called hold on.